Next is Senator Cortez Masto.
Thank you, Mr. Chairman. Secretary, it's always great to see you. Thank you. Before I get to my questions, I do want to quickly touch on Medicare Advantage. Seniors in my state rely on Medicare Advantage to access affordable, high-quality health care. I often hear from Nevadans how vitally important this program is to supporting their health and the health of their loved ones. That's why I have been a long supporter of Medicare Advantage. This year, I am proud to have led the annual bipartisan letter, and I believe there were 57 senators of my colleagues that signed on to the letter urging the administration to preserve and strengthen the program. Last week, I spoke with CMS Administrator Brooks LaSure about the proposed updates to the program for 2024 and what they mean for Nevadans. And I will just reiterate today, Mr. Secretary, that any efforts to address overpayments in Medicare Advantage should support program integrity and preserve the sustainability of the entire Medicare program without disrupting access, without increasing cost or jeopardizing the quality of care. So as you move to finalize 2024 policies, I urge you to prioritize the program improvements that benefit patients and deliver value to seniors and taxpayers. So just wanted to start with that. Secondly, I too notice all the purple here in the room. Thank you to the Alzheimer's Association, to everybody who advocates. It's something that dealt with in my family with my grandmother, so appreciate your advocacy over the years. Thank you. You will always have a supporter with me. Secretary Becerra, let me talk about the commercial prescription drug inflation rebates. Last year, as you well know, we passed historic drug pricing policies in the Inflation Reduction Act. This law is already working to lower drug costs for our seniors with Medicare. Importantly, the Inflation Reduction Act penalizes drug companies for raising prices faster than inflation. However, as it stands today, these companies are only held accountable for hiking drug prices in the Medicare program. That's why I'm introducing a bill to extend the inflation rebate penalty to include drugs used by people with private commercial insurance. My bill will ensure that Nevada families, as well as our seniors, are no longer squeezed by drug companies' outrageous price hikes. So, Secretary Becerra, I'm glad to see the goals of my bill reflected in the president's budget proposal. How would the inflation rebate penalty for the commercial market impact drug prices for patients at the pharmacy counter, as well as healthcare payers like employers and unions?
Senator, well, first, thank you for that effort. We want to help as any way we can because we know what happens. Take insulin. Insulin was only to apply to those who are on Medicare, 67 million Americans on Medicare. Today, the three leading manufacturers of insulin have said they're going to drop their price of insulin for those who aren't on Medicare, so those in the private insurance market. And so we see what happens when you introduce competition into this. The prices come down because everybody now has to compete to get your business. Your bill, I suspect, would do the same thing. It would introduce that competition in the private insurance sector, so it would complement what we do in Medicare, and if the end result is you drop the price for a whole lot of Americans who aren't on Medicare.
Thank you. I appreciate that. And let me just add that my commercial prescription drug inflation rebate bill has the potential to generate significant savings for the federal government. In fact, CBO projected that a similar provision would save $34 billion over 10 years. So I thank you. Let me jump to something very quickly here as well. Mental health. I've heard my colleagues are talking about this. As you well know, this is such an important issue for me as well, and I support my colleagues on both sides of the aisle for working to address this. And I appreciate the support for the crisis services in the budget proposal around mental health and the funding 23 bill, or fiscal year 23 funding bill. The significant expansion in funding for 988, the new suicide and crisis lifeline, has helped communities manage increased demand and call volume since the line went live last summer. I know, I talk to my folks in Nevada all the time about this. On this committee, we're very focused on what comes next. What happens when someone in crisis dials the line and needs somebody to come help or somewhere to go for that treatment. I was proud with the chairman to pass increased funding for 988 and crisis care through mobile units in the December omnibus bill. But we have more work to do. So my question for you is, in your view, what is the biggest challenge to improving crisis care coordination when we're talking the mental health support that's needed across the country?
Senator, workforce. We need to hire up more folks, pay them decent wages so they'll stay in the field, because right now we know that healthcare has a shortage of workers, period, but mental health even worse. And so if we really want to say to somebody, call 988 and you're going to get real help, we have to make sure that there really will be real help at the end of that call.
Look forward to working with you, because I'm hearing the same thing. I see it in my state and across the country. So thank you.
Thank you.
I thank my colleague for her questions, and especially the points about MA, Medicare Advantage. We've worked very closely on this committee with Chairman Casey, who's also put in a lot of effort on this at the Aging Committee. And just a quick word. I believe Oregon, Nevada, and Minnesota have the highest percentage of senior citizens in MA in the country. And having spent a lot of time in these precincts since my days working with seniors, I've come to the conclusion that unfortunately not all Medicare Advantage is created equal. There's been some very good MA, there's been some not so good, and we're going to work very closely with our colleague to make sure we get the former and have less of the latter, because her points are very well taken, and we're going to work closely with the administration to make sure that we recognize that kind of distinction, and I appreciate her comments. Next.